welcome. I'm Alice Barraclough, and today my guest is the wonderful Dr. Sandeep Kapur from Mayo Clinic Healthcare. Mayo Clinic, for those of you that don't know, is a huge medical centre in the US, and last year opened its first clinic in London in Portland Place. Today we're going to be talking about life after COVID. So I'll be leaning on Dr. Kapur's expertise and experience. He has over 15 years of practice as a GP, and he has a particular interest in medical technology, diabetes and healthcare quality. And as well as being a member of the Royal College of General Practitioners, he is a specialist GP advisor for the Care Quality Commission and an examiner for the General Medical Council too. So he knows his stuff, he knows what he's talking about. So Dr. Kapur, why don't you start by telling us a little bit about your role at Mayo Clinic in London?
Thank you, Alice, for that wonderful introduction. That was very delightful. So I'm one of the physicians at the Mayo Clinic in London. Mm-hmm. As you say, we opened operations back in September last year, and since that time we've gradually grown, and we're now going to become a multi-speciality clinic where we'll have multiple specialists within the clinic providing excellence in healthcare. Our aim really is to provide an unhurried consultation where we actually listen to the patient and then sort of undertake thoughtful investigations. So we really do tailor our whole patient experience around the patient themselves.
So how does coronavirus differ from the seasonal flu?
So 80% of patients, they have a mild illness, and that can be maybe completely asymptomatic. Mm-hmm. They may have just an upper respiratory tract infection, so symptoms like a sore throat, a bit of a cough, or they may have lower respiratory tract infection symptoms, which means they're developing more like a pneumonia. Right. But all of those presentations can also happen with the flu. Yeah. So it can be very difficult to distinguish the two. And it's also possible that you could be infected with both viruses. Right. So it's going to be quite difficult in some cases to distinguish between the two. But the management for those mild cases is going to be the same for the vast majority of patients. So that's supportive treatment in terms of fluids, rest, paracetamol, so simple painkillers, and just maintaining, as I say, hydration.
How might the flu jab help protect us against COVID-19?
So we're uncertain as to the effect of the flu vaccine on the actual COVID virus. Right. But going back to what I said about people getting both infections, if we can reduce the extent of the infection with the influenza virus, then that improves patients' outcomes. Okay. So I would advocate that everyone should try and get themselves immunised against influenza as much as possible. Just then it reduces your risk of having a bad outcome with the influenza virus. Mm-hmm.
It was actually in the news this morning about pregnant women and a lot of doctors advising that if you're pregnant, it's especially important that you get the flu jab as soon as possible. Why do you think that is? Is it because if you're pregnant, you have an increased risk of getting COVID-19?
Well, we know that in some cases pregnancy can suppress the immune system to a degree, and so women can have a more severe disease. And so for that reason, immunising against influenza is very sensible. Right. As to the transmission of SARS-CoV-2 in pregnancy, we're still in uncharted territory there. So there's still data that's emerging that we're still analysing.
And once you've been infected with coronavirus, if you are infected, your body produces antibodies.
That's right.
How long do these antibodies last? And if you have them, can it make you immune?
So, very good. Two very important questions. So, the first question is that we are still unsure if you develop antibodies, whether that does make you immune. Okay. So, what we know at the moment is that if we detect antibodies, that shows that you've been exposed to the virus. There is still debate around whether that actually confers immunity. Okay. As to the duration and if it does confer immunity, we're uncertain as to the duration of that. whether it provides a lifelong immunity
or a couple of weeks,
or whether it's as short as 6 months.
Do you have any tips for anyone that's perhaps feeling a little bit anxious or more anxious than usual? How can you tell if it's more than just a bad mood?
Yeah, it's had a big impact on all sort of sectors of society.
Yeah.
So, be it our patients that are over 65, the older folk that are sort of socially isolated and shielding. For those, one would want sort of people to perhaps reach out to them and go and visit. For younger people that have pre-existing mental health problems, looking at new ways of being able to establish contact with them. So a big field that everyone's seen that's grown is telemedicine.
Yeah.
And so being able to utilise those modalities is probably the way forward in terms of connecting with those people. It's not perfect. There is something beneficial to that actual face-to-face contact in person, but I think it's the next best thing that we do have, and given the current climate, it's the safest thing to do.
Yeah.
And so exploring those ways of connecting with those patients is very important.